Hello, my name is Robert Tasker and I'm the Editor-in-Chief of Pediatric Critical Care Medicine. Once again, thank you for being involved with SCCM and being subscribers to PCCM. I have 3 editor's choices for you this month. In addition, a couple of surprises which will come at the end. The first editor's choice is by Dr. Axon and colleagues, and it looks at 9,000 patients, their real-time continuous data, and asks the question as to whether or not it is possible to model severity of illness in real time. Our editorialist puts this work in context and asks more questions. How do we deploy this type of work, and what do we use with the information? The second paper is by Dr. Deshpande and colleagues, and this is a single-center coagulation study of 133 ECMO patients, looking at what should we do with this information, what can we do with this information, what do we do with this information. There's a great editorial that comes with this, and finishes with the question that we have had 7 articles in PCCM over the recent years about coagulation in ECMO cases. When are we going to solve this problem? And then another accompanying piece is a study which is an updated survey of 79 of 108 ECMO centers looking at their coagulation practices. The third article is by Dr. Inata and colleagues, and that looks at the state of quality improvement research in the PICU. It presents data from about 158 articles and summarizes these, an important resource. And now to the 2 surprises. I've introduced 2 special types of grouped items for readers and subscribers. The first is about vitamin C. Dr. Yanasi and colleagues provide a scoping review on parenteral vitamin C. Our editorialist talks about potential sepsis trials, and then we also have a statistical note on scoping reviews. And then the other grouped items starts with a brief report by Dr. Moffat and colleagues on the VPS database looking at negative pressure ventilation. And then we have 2 viewpoints that present another view about this information. One presents the view we need a better registry rather than moving on to randomized controlled trials. And the other view says we need to better understand physiology before moving on to clinical trials. So altogether, an action-packed and worthy read in the whole journal this month. Again, thank you very much for subscribing and supporting the journal. See you next month. Goodbye.